NBC4 News at 4 starts now.
And back to school usually means back to the doctor. The important checkups many children are missing. One of the major collateral effects of the COVID crisis has been a decline in wellness visits with doctors. That includes a drop in vaccinations for children. And now pediatricians are trying to impress upon parents the importance of protecting their children against longstanding health threats that certainly could reemerge. NBC4's Patrick Healy joins us now with more on that story. Patrick.
Carolyn and Michael, this is an issue we have been following, and there are indications that in recent weeks, since the depths of the COVID closure shutdown, that there has been some progress, that more vaccinations, more immunizations are being done. But the evidence indicates we're still down on the order of 30 to 50%. And bear in mind, on the horizon is the prospect of schools eventually reopening.
So I remember that Friday morning, we got out of the car, we were walking to preschool.
That's when parent Sandy Rodriguez got the call that her 4-year-old's well-visit checkup with the pediatrician and 4 immunizations would have to be postponed due to the onset of COVID safer at home.
I was worried because my daughter was already behind for her 4-year well visit, and then we have COVID-19.
Ultimately, in June, Zara got her checkup and vaccinations.
What put me at ease is our pediatrician told us that no sick children were coming through this particular clinic. So it was only open for well visits.
But even with clinics resuming and offices reopening, many families have not caught up with childhood vaccinations, and that is a growing worry.
If we don't go and get the vaccines ready for our kids, we're opening the window for so many diseases, especially here in California, that we have seen in the past.
MD Ilan Shapiro, medical director of health and wellness at AltaMed, has seen the drop-off in his own pediatric clinic.
We're actually seeing like at least 30% less kids that are coming for the World Childs. Then that means that 30% less people are getting their vaccines.
Last year, California saw some 5,000 cases of one vaccine-preventable disease, whooping cough. Mumps is another.
It's worrisome because I've even had friends whose children have gotten the mumps.
I'm from Mexico. I actually have seen meningitis. I have seen complications of whooping cough. I have seen measles and mumps, things that, are horrible, and I have seen the consequences of all these diseases. And for me, it's real.
He warns there's risk even while children are not physically at school.
On reality, we all are exposed, even though that we are sheltering at home.
His message is that clinics take COVID precautions so it's safe for well visits and immunizations. Zara's mom speaks of the peace of mind of getting her immunizations up to date.
It took a lot of stress off of me because now it was done. And looking back, I mean, we didn't get sick, we were safe, we were protected, and everything went fine.
Now, a number of the standard immunizations are actually required before children can attend school. So again, with so many children now behind on their scheduled immunizations, this is yet another issue that's going to have to be dealt with before classrooms can welcome those children back. For now, reporting live, Patrick Healy, NBC4 News.
All right, Patrick, thank you.